We come back after the break. We're going to shift gears and talk about breast cancer rehabilitation, since this is the rehab show, by the way. Exercise and breast cancer rehabilitation with Shira Litwack. She's a cancer exercise specialist and director of international relations at the Cancer Exercise Training Institute in Canada. I think she's up in Toronto somewhere. What a beautiful city that is. Dr. Marc Siegel, this is the Rehabilitation Medicine show. I'm the medical director of Dr. Radio. I'm in for Dr. Jonathan Whiteson today. We'll be right back. Welcome back to the Rehabilitation Medicine Show. I'm Dr. Marc Siegel. I'm in for Dr. Jonathan Whiteson. I'm the medical director of Dr. Radio. By the way, I've known Dr. Whiteson his whole career, and let me tell you something. He was a star even when he started. I was in those days, I used to do medical consultations on the rehab service here at NYU Langone, and I used to give a weekly lecture for all the rehab residents. And Dr. Whiteson was one of the best residents we ever had. And of course, he went on to be the head of cardiac rehab here at NYU. So it's an honor to be sitting in his chair today. And we're talking about Breast Cancer Awareness Month now, and we're going to start off in this half hour talking about exercise and breast cancer rehabilitation, which is apropos because it is the rehabilitation show. And we're joined on the phone by Shira Litwack. Shira Litwack is a cancer exercise specialist and director of international relations at the Cancer Exercise Training Institute in Canada, which provides continuing education to health and fitness professionals in order to empower cancer survivors during treatment, recovery, survivorship. This institute stresses exercise therapy as a critical component of cancer recovery. Shira, welcome to the show.
Good morning.
I want to start off by asking you about a study I happen to know about, because I was reporting on what Sloan Kettering Memorial is doing in terms of studying exercise and breast cancer in terms of treatment. What do you think about that?
Well, we've known for a very long time, but the wonderful news is we just keep coming out with more and more studies that tell us the importance of exercise, and not just as a broad sweeping statement, but really focusing in on the issues that people have from breast cancer, prevention of breast cancer, rehabilitation from breast cancer, and also dealing with treatment issues.
What about,
because unfortunately, sure, go ahead.
Well, so treatment issues are, let's break this down and talk about both. Treatment issues are someone has breast cancer. Obviously, there's different kinds of breast cancer. There's breast cancer where you're lucky enough to get it before it escapes the breast. You have a lumpectomy, radiation. Right. You get over the side effects. Then there's metastatic breast cancer, which you're dealing with in a totally different way. What is the role of exercise in each? So exercise in limited disease, extensive disease, and then as a preventative.
Okay. Well, the best way to look at this is there are, unfortunately, let's talk about potential side effects. There's a number of potential side effects. In the most recent studies, one of the biggest frustrations that I have dealt with women and men, forgive me, for recovering from breast cancer is memory issues. And again, we have new studies that came out in July this year that told us about how exercise reduces the memory issues that people suffer during treatment. Again, treatment obviously is very necessary, but unfortunately there are going to be side effects. It reduces the risk of chemotherapy-induced neuropathy, and a very unfortunate side effect, potential, I should say, side effect of treatment is heart disease. And our newest studies are completely in agreement with previous studies we've had, and how the right exercise, and every time I say exercise, please remember I'm saying the right exercise in terms of the prevention of heart disease.
In women that have gotten chemotherapy?
In women who have had chemotherapy, in terms of radiation, both surgery and radiation to the lymph nodes, which unfortunately is more common than not. With breast cancer treatment, a potential is lymphedema, which is painful, it's debilitating, and we all find that many people are not warned about the potential for lymphedema, but by doing the right exercise, they can very much minimize the possibility of lymphedema.
Just to distinguish those 2 points, so chemotherapy, certain chemotherapies, you're worried about the risk of heart disease. In all breast cancer where you're having the breast removed or part of the breast removed or radiation to the breast and lymph nodes, you worry about lymphedema and painful lymph nodes or swellings in the area of lymph nodes that you remove, and then certain kinds of exercise can combat that. Are you talking about cardiovascular exercise for the main, or what type of exercise?
Cardiorespiratory exercise, there's no question that is very important for a number of reasons, but also there's specific strength exercises. And remember, when I say strength, I don't mean necessarily with added weight, but a number of different exercises for the prevention, specifically for the prevention of lymphedema. First of all, we know everybody needs to get, who's had treatment. Range of motion is a serious issue, and it can be debilitating in our functional daily lives. So the exercise can certainly help with getting back our functional daily activities, what we call range of motion, being able to move freely, but also in terms of opening up those channels, letting the lymph flow so there's no possibility of lymphedema. And the other thing that I want to mention is we obviously need our immune system to work for us as much as it possibly can. And this is something that far too often gets ignored. And unfortunately, many women do not necessarily strength train. And our muscles are our very best friend in life. And we need those strong muscles to help pump our immune system. So these are all many different aspects, but lymphedema, absolutely. Radiation, chemotherapy, induced issues, absolutely. Many aspects to exercise.
We're talking about breast cancer rehabilitation. It's Breast Cancer Awareness Month. We're talking about exercise as a role of treating your breast cancer. Very, very important topic. We're talking with Shira Litwack, who's a cancer exercise specialist and director of international relations at the Cancer Exercise Training Institute. This is Dr. Radio. I'm Dr. Marc Siegel, medical director. I'm in for Dr. Jonathan Whiteson on the Rehabilitation Medicine show. We're on Sirius XM channel 110. Give us a call at 1-877-NYU-DOCS. That's 1-877-698-3627. Or email us if you're shy at docs@SiriusXM.com. Shira, let's jump right away to the most controversial area, which is prevention. A lot of women out there don't have breast cancer, but maybe they're worried about getting it. Maybe they're worried about their risks. Well, we don't have enough literature on this yet to be definitive, but let's talk about the fact that being overweight is a risk for breast cancer. Eating fatty foods is a risk for breast cancer. So can you decrease your risks of breast cancer by exercise, in your opinion, even if we don't have all the science yet? And what exercise would you urge everyone out there to do?
Well, we do have a lot of science. We really do. And my issue with science, and please back me on this, is how many studies does it take till we accept something, till we believe something? Not just with breast cancer and cancer, but with heart disease, with many incredible benefits of exercise. So, of course, exercise is huge and respected by all of our major cancer institutions. It's a huge part of cancer prevention, but definitely we need cardiorespiratory exercise. We need to do strength training. Far too many people, as I mentioned before, do not strength train. I mean, let's look at it this way. Our lower body muscles, if we're talking about our glutes, our leg muscles, those are what we call our power pump muscles. And what those do is they really pump the blood back to the heart and give us a nice, strong stroke volume. So every single time our heart beats, it beats with meaning. In other words, it shoots the blood out to the body. So, I mean, it's a huge part of our immune system, our digestive function. People, unfortunately, do not understand how important our digestive system is. And in many ways, it can be considered before the immune system. We hope that our digestive system shuts down a number of potential mutagenic and carcinogenic agents. So again, these are all aspects of exercise, and of course, lowering adiposity, lowering body fat. People have to think about fat. The best description I've had of body fat that I've ever heard is that we have to think of fat cells as active endocrine glands, that they're not just innocent little blobs that sit there, but they secrete hormones, and they put our hormones severely out of balance. Insulin production, inflammation in the body, oxidative stress, and by controlling our body fat levels, that's a very important part of cancer prevention.
Now, full disclosure, I'm a huge fan of cardiovascular exercise. I'm a mountain biker.
Good for you.
I exercise every single day, maybe 6 out of 7, because my argument about the 3 out of 7 people out there is you never get that. When you say you can exercise 3 out of 7 days, it's always the day you're not exercising. So shoot for 7, and you'll end up with 6. And
totally agree.
And I like cardiovascular. I'm a fanatic on that. I don't do enough of the strength training you're talking about. Because again, if I have limited time, I want to get that 45 minutes in the gym where I'm doing the bike or the elliptical or the treadmill. And the way I get my patients to do it is I say, take your Netflix there. Take your Amazon Prime to the gym and watch your House of Cards in the gym, watch your whatever it is, watch your news, get your news fix. I guess everyone's running away from the news right now, but get your fix in the gym. And I'm not saying I'm not a fan of the sit-ups and the push-ups and the weights.
No sit-ups.
I'm just saying that I start with cardiovascular. So that's me, and I don't. What about women out there that are worried about breast cancer? Is that 45 minutes on the elliptical going to help them, or what would you recommend?
I'm very cautious to say that because we also have to understand that depending on how people interpret those numbers, we don't want people to over-exercise. Now, unfortunately, many people might think, 10 minutes, I've over-exercised. No, it's not like that. But what we have to realize is that there is such thing as too much of a good thing, and we don't want to put stress on the body and go in the opposite direction. So, for instance, when you see, and yes, I see many more women do this than men, when you see women who are going on the Stairmaster and they're climbing and climbing and they're keeling over and they can hardly, we've all seen it, let's be honest, and they're keeling over and sweat dripping from them and they can hardly walk. We also notice when we look at their body, there's not a drop of muscle mass on their body, and their skin and bones, no, that's not healthy. That is absolutely not healthy.
So you want to maintain a proper body tone or muscle tone and not become emaciated. Let's go on to the part. You've talked about the immune system. You've hinted about that several times. I'm a huge believer in that if you want to rev up your immune function, exercise is a way to do it. I think weight loss, even though there's some controversy on that, look, even if you're turning your fat to muscle and your muscle weighs more, that's still a better body to have. We're talking about the effects of exercise in terms of cancer and what the psychological benefits are. And do the psychological benefits spill over to the physiological benefits? In other words, you feel better. Does that now make your immune system work better? Does that make your heart work better? How does that work?
It works with the immune system in a number of different ways. And one of the ways that I really want to inspire people to exercise is, yes, the immune system does not have a pumping system of its own. It takes our muscle mass to pump our immune system. The other thing is we all know about this high we get during exercise, this, endorphinated feeling, the adrenaline rush. Well, we have many studies which tell us that adrenaline rush also gives our natural killer cells a huge part of our immune system. That adrenaline also gives our natural killer cells a rush as well. So again, it stimulates the immune system in a number of different ways, not to mention full body oxygenation. So again, there are just so many ways it works. But again, I think we also need to mention the digestive system. Thanks to Dr. Michael Gershon, I think it's about 20 years ago now, he proved that most of our serotonin, our happy hormone, is produced in our gut.
Shira, you were just talking about how it works in our gut, that you do your exercise, it helps you psychologically, it works in our gut. And I also want to get on to the idea about how if you have breast cancer and then you end up with treatment, you're going to get depressed from the treatment or from the cancer or from how you feel, the sudden shocking news or the depressive effects of chemo. And I want to get to what the role of exercise is on that. We're going to try to get her back on the line. In the meantime, if you have questions about breast cancer and exercise and what the role of exercise can be, whether it cuts down on your risk of breast cancer, whether it helps you treating it, how do you exercise if you feel like garbage because of the treatment? If you're fatigued, if you're having side effects, how do you get out there and exercise? If you're wondering about that, give us a call at 1-877-698-3627. That's 1-877-NYU-DOCS, or email us at docs@SiriusXM.com. This is the Rehabilitation Medicine Show. I'm Dr. Marc Siegel, in for Dr. Jonathan Whiteson today. We're talking breast cancer rehabilitation. So I was just asking about what do you do if you feel like crap from the treatment from breast cancer? What do you do then? I'm going to encourage you to exercise. How do you do it?
Well, that's why we can't just encourage people to exercise. We need to give them guidance. And we have to remember exercise is a relative term. So instead of just necessarily encouraging people to get up and go to the gym, which many people don't want to do if they're suffering the many side effects of chemotherapy, is to move. And we have to remember the importance of both exercise and physical activity. And very often, getting moving is the hardest part. So we can go through, even if we start deep breathing, even if we start singing, we get our body moving. And then limb by limb, deep breathing, doing many just contractions, doing what we call little isometric contractions of the core, of different muscles to get our body moving slowly. The more we start stimulating our circulation, the more we want to move. It's not like we can jump up, get up, okay, go start pumping at the gym. It doesn't work like that. And when we're recovering from breast cancer, very often a person says, I don't have energy to get up, and you're telling me to go exercise? Well, we can start with doing certain exercises if we're lying in bed. And we can start doing certain muscle contractions, deep breathing. I always recommend singing. Singing is a fabulous way, even if it's whisper singing, and to get the body moving smoothly, fluidly. And it's amazing how much we want to get up and move. But we have to start with those baby steps in order to get up and to exercise and to get our physical activity. So even if it's a day that we're not going to do, quote, exercise, at least make sure we're getting regular physical activity during our waking hours.
Quickly, we have an email from Megan. I don't have breast cancer, but I have had my right ovary removed, have scar tissue that continues to grow, and it's painful. Is there any kind of exercise, anything I could do that would help that? And that could also be brought to the issue with breast cancer. What if the woman has scar tissue? What if she has pain in the area? You mentioned lymphedema. What if it hurts to exercise?
There are a number of exercises that we can work through with people that getting full range of motion back. And it sounds like, I don't really understand what type of pain she has, but if we get the movement going, if we can start with the right stretching exercises, we always do a little bit of a cardio warm-up, meaning not necessarily going on the elliptical, but just doing some easy walking. We start moving, and then we can do exercise. Maybe we need to strengthen those pelvic floor muscles, which is very possible. Pelvic pain can be a serious issue, and if we do our proper, that's where Pilates is absolutely top of the list, is just getting those pelvic floor muscles working and getting that range of motion back and bringing circulation to the area. I would definitely recommend there. Obviously that has to be cleared with her physician. But what she needs to do is then look at doing some movement, looking at stretching and some Pilates exercises specifically for around the pelvic floor area, maybe some exercises to strengthen the core area. And again, these are all things that are covered in Pilates. But remember, Megan's got to remember this is a build-up. This is not something that she should try and tackle right away.
And even walking is a great exercise if that's all you can do. Just getting up and out of bed if you can and walking. Right, Shira?
Absolutely.
Okay. Thank you for joining us. Shira Litwack today is Cancer Exercise Specialist and Director of International Relations at the Cancer Exercise Training Institute. We'll be back after the break